Welcome to Inspiration Health Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. As we get older, we know we need to take better care of our bodies, which sometimes includes our stinky feet. In addition to keeping them clean and dry, did you know that your socks matter too? Well, they do. In this episode, we're going to talk to a podiatrist about taking care of our aging and aching feet. But first, Millennium Physician Group is a leading comprehensive independent physician group in Florida with more than 700 healthcare providers at 150 locations in 19 Florida counties. We serve nearly 500,000 patients. Millennium Physician Group, your connection to a healthier life. Learn more at millenniumphysician.com. Connection, innovation, inspiration, health. Each week, we talk about the healthcare issues that are important to you by inviting providers and experts to inspire you to take control of your healthcare decisions. Join us right now for a healthcare journey as we work together to achieve the best health outcome for you. Well, according to dailycaring.com, just some random site I found when searching feet, healthy feet are essential for seniors to stay mobile, balanced, and as independent as possible. Seems easy enough, but our aging feet do need a lot of TLC. Our guest today is Dr. Norshay Robinson, a podiatrist who specializes in keeping our feet happy. Don't you, Dr. Robinson?
Thank you.
All right, well, welcome to the show.
Thank you.
Give us a little bit of background about yourself, about your clinic, and then we're going to talk all things feet.
Okay. So hi, everyone. As Michelle introduced, I am Dr. Robinson. I practice with Meridian Podiatry. It's my practice that I started a year ago here in Jacksonville, Florida. And we treat patients of all ages, from newborns all the way up till the aging population, which is the focus of our podcast today.
Right. Well, because baby feet are so cute. And then aging feet, not so much.
If we don't take care of them, they can be.
All right.
They can be.
We're going to talk about keeping our feet cute and happy. But what's your background? What led you to podiatry?
So I actually worked with a podiatrist when I was in college, and that's kind of how I got into podiatry. I liked the flexibility of it all and being able to treat different conditions in the feet on a day-to-day basis, not doing the same thing every day, and having the ability to do surgeries on my patients, seeing them in the office, treating conditions that they have, treating babies, treating middle-aged, adults, older patients, everybody. So being able to take care of everybody and having everything available.
Yeah.
And that's kind of why I got into podiatry. After that, I went to Temple School of Podiatric Medicine, and then I did my surgical residency in Brooklyn, New York at Wyckoff Heights Medical Center, and then I moved to Jacksonville.
Wow. Yeah. So straight down the East Coast.
Yeah.
Well, feet.
Yes.
Pretty important.
Very important. Often neglected.
And often neglected, right? So give us a little bit about feet. We know there's a lot of bones in the feet and muscles and sensory nerves and all that stuff. Just kind of give us the anatomy of a foot, to kind of give us the short man layman version of our feet.
Okay, so there are 26 bones in the foot, as small as they are, each one. And there's hundreds of muscles, several ligaments that all come together to perfectly support the foot. I think the biggest areas that we want to highlight that will be beneficial for the future conversations would be the heel, which is the back of the foot, which is where you bear most of your weight, the arch, which is the central portion of the foot that most people often have trouble with, and then the ball of the foot is that portion that's further towards the toes from the arch, but before you get to the toes, and then the toes, and then the top of the foot, everybody knows. So those 3 or 4 areas, so that when we talk about them in the future, you'll know exactly what we're referring to.
Yeah, feet. Totally interesting. We live in a beach community, so you always see people in flip-flops. You always see people barefoot or wearing those silly shoes with the toes cut out. So a lot going on. Is it important to keep our feet clean and dry?
Both. The feet are a part of the body. The same way you would take care of the rest of your body, it's the same way you would take care of your feet. So taking a shower, bath, cleaning your feet properly, removing all dead cells that we shed normally, like the rest of our body, removing that because that can harbor bacteria, and you can also get fungus in the feet because of that. So cleaning your feet thoroughly, drying them properly, because fungus likes moist environments. So the feet are in dark shoes every day, they're moist. That is the ideal environment for fungus to go happy and do whatever they want. So
is that what causes the stink in the feet?
Yes, it's fungus. that causes the smell that we often are ashamed of when we take our shoes off, and everybody knows.
Right. So, I have a real bad habit, or maybe it's a good habit, of putting like foot powder in my shoes before I put them on, like if I'm wearing heels or something. But then when I take off my shoes, there's little footprints all over the place. Does shoe powder work?
So it does. And the downside, like you mentioned, is getting powder everywhere. But it does help to keep the shoe dry. It helps to keep your foot dry, absorb any additional moisture. And most of them, or some of them, have antifungal properties in there, so it will kill any fungus that the powder comes into contact with. But I usually recommend for my patients to use a shoe spray. So that way you're killing the fungus, bacteria, mold in the shoe without shedding powder everywhere when you remove your shoes.
So maybe I should move to a spray. So when I go to yoga and I'm on my mat, you don't see my white feet on the mat. I'm always kind of embarrassed.
Leaving footprints behind on the mat.
I always feel like when I come home and I take off my shoes that the carpet will, wear off the powder, but the spray. Yes. So do you recommend spraying the shoe before you put it on or at night?
Usually, if you have a shoe that you wear frequently, spraying that when you take it off. So that way it's dry when you go to put it on the next morning or the next time. But usually after you wear them, spraying them down, or the first time you get the spray, going through spraying everything. If the shoe has an insole that comes out, removing that insole, spraying that down as well, because the fungus will live between the shoe bed itself and the insert that comes in the shoe. So removing that, spraying everything down, letting it dry properly, and then wearing them.
All right. I love it. But okay, so to take better care of our feet, we want to make sure they're clean and dry, but are we wearing the wrong shoes?
Well,
most likely.
Most people, a lot of people, I wouldn't say most, a lot of people are, especially here in Florida, like you said, the beach, everybody's in sandals and flip-flops. It's really hot. No one wants to be wearing closed shoes every day. But not everybody has the same issues with their feet. So a shoe that may be okay for one person to wear may be detrimental for another person. So it all depends on the overall foot itself. Each foot is different.
Yeah. We are talking with Dr. Norshay Robinson, a podiatrist who is specializing in keeping our feet happy. We're talking a little bit about the foot itself. Now, I mentioned at the very beginning of the show about the right socks. So, people like the no-show socks, or they like the ankle socks, or the other socks that cut off the circulation. So how do you pick a sock, and should you wear a sock?
Yes. So socks are helpful with absorbing and wicking away moisture from the foot, helping to keep the foot dry, because we spoke about that being very important. But having a sock that fits properly is also equally important. So a lot of times if the sock is too big, there will be rubbing of the sock against the skin when you wear a shoe, which then causes friction and blisters, or those red spots that you notice from irritation. So it is definitely important to wear the right size sock, but also wearing a sock if you have a closed-in shoe, because your feet sweat.
Oh, yeah, absolutely. And runners with socks, now they have like socks you can get with kind of like an arch support in the sock. Yes. Is that helpful for?
So it's more of the compression. So compression helps to decrease muscle fatigue. So the same reason why you would wear a compression sock up to the knee for runners, or even a compression sleeve that just encompasses the calf, it's the same reason that you would wear it in the arch. It helps to decrease the fatigue in that area by giving additional support. That constriction provides additional support.
Okay, we're going to talk a little bit about compression later on too. Now, you mentioned blisters real quick, and as our population, as we get older and we have mobility issues and maybe some balance issues, can blisters be a part of that?
So blisters usually indicate that there's abnormal rub against the skin, and that superficial layer of the skin usually shears off, or you can have where it fills in with fluid underneath and then it shears off. So wearing the right shoe, a right fitting shoe, to help to prevent that. But also with the aging skin, it is a lot thinner and a lot drier, so it's more prone to getting blisters or even skin tears from the friction.
Mm-hmm. And then that can cause infection even.
Yeah, so any break in the skin can cause infection. Yeah, so you want to always protect the skin as best you can to help to prevent any breaks in the skin, because that's how pathogens enter, and you get bacterial infection, fungal infection, yeast, mold, whatever.
Yeah, and we're going to talk about that coming up too. So stick around. Dr. Norshay Robinson will talk about foot injuries. We're going to talk about some treatment coming up in the next segment. We're also going to talk a little bit about orthotics for our arches. I know my arch is painful at times too, and padding. So stick around. The conversation will continue. Inspiration Health Radio is sponsored by Millennium Physician Group. We'll be right back. Welcome back to Inspiration Health Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. Each week, we talk about the healthcare issues that are important to you by inviting providers and experts to inspire you to take control of your healthcare decisions. As we get older, we know we need to take better care of our bodies, and that always includes our feet. Don't forget about your feet there at the bottom of the body. In addition to keeping them clean and dry, we found out in the last segment that socks matter too. So in this episode, we are talking to a podiatrist about taking care of our aging and mostly aching feet. I know I have super aching feet at times. Our guest today is Dr. Nershay Robinson. She's a podiatrist in Jacksonville who specializes in keeping our feet happy. And Dr. Robinson, we talked in the first segment about shoes and socks and keeping our feet clean like the rest of our body. But our feet, and we touched on it at the very end, are prone to injuries. So not just like skin tears and blisters, but anything from ingrown toenails to sprained ankles. And my young daughter, has ingrown toenail problems all the time. Now, can we talk a little bit about that? Because it's got to be something you see pretty commonly, especially in the older population too.
Yes, so it's twofold. So we'll see it in younger kids before adolescence as a very big population. And then the older population is where you'll see it coming back again with the ingrown toenails. So yes, it is very painful, very uncomfortable to deal with. But yeah, we do have several treatment options for them.
What causes them?
So an ingrown toenail can be caused two ways. The first being that the nail itself, the shape of the nail where it curves down into the side of the skin, growing into the skin, causing pain and inflammation. Sometimes it can break the skin, which is when it will become infected. The red, swollen drainage, that's when it's become infected. The other issue that can result in an ingrown toenail is trauma to the nail. So the nail presses up against the skin on the side of the nail. That's normal. But if you wear a shoe that's too tight, or if something hits your toe, it can cause that nail to penetrate that skin, breaking the skin. Now you get bacteria that enters, it gets swollen, it gets inflamed, the nail presses in further because the skin is more swollen, and it's an ongoing cycle.
Yeah, my daughter had terrible issues with ingrown toenails, and then I think she would try to kind of cut it out herself, and that causes more trauma. Yes. And then we ended up having to go see a podiatrist for any help at all, and that's even more painful, I think, at times. Well, but helpful.
Yes, and we actually do have a new treatment for ingrown toenails that's actually pain-free.
Oh, do tell.
I know. So it's called Onifix, and what it does is it's a small band that's applied to the base of the nail, and it supports the nail as it grows out to correct the shape and prevent that curving in on the sides of the nails. That usually is what causes pain. So it kind of trains the nails like braces for your teeth, but it's not painful, and there's no metal to it. And it just supports the nail as the nail grows out to allow the nail to grow into the normal shape that it should.
Now, who qualifies for that?
Anybody
anybody?
Has an ingrown toenail or pain with the nail growing into the skin. Yeah.
Does Medicare cover that?
Medicare does not. This is a fun new treatment, Michelle.
Yeah, we gotta wait. We gotta wait to see if it's if they should.
Yes, they should.
Yeah, they should.
They don't.
Yeah,
but no, it's a new treatment. Unfortunately, it's not covered by insurance, but it does provide significant relief for patients, especially patients that are not candidates for a nail procedure. So, a patient with significant poorly managed diabetes, peripheral artery disease, those are patients that this is specifically beneficial for, because a nail procedure can cause significantly more harm for them because of their underlying medical conditions.
That makes sense. That really makes sense. Now, back to like other injuries that we can do to our feet, including sprained ankles. So do you see a lot of sprained ankles in your practice?
I do see a lot of sprained ankles, actually. The biggest thing that causes a sprained ankle is a previous untreated sprained ankle. So once that ligament gets damaged, if it's not rehabbed properly, then you're more prone to spraining your ankle again in the future. So definitely, if you have a sprained ankle, being sure to get it treated appropriately right away, doing the correct therapy to help to strengthen everything around the ankle, help to support the ankle to prevent a future injury in the future.
Do you consider like plantar fasciitis? Is that an injury, or is that something that happens because of overuse?
So it can be both. Basically, plantar fasciitis is an inflammation around the plantar fascia, which is the ligament on the bottom of the foot that supports the arch. Now, unfortunately, over time, the arch can collapse, and that puts additional strain on the plantar fascia, which then would precipitate plantar fasciitis. But however, high impact activities can also cause inflammation around the plantar fascia, which would then lead to plantar fasciitis. So you get up, spring, it's nice and warm outside. We decide we're going to be runners. So we get out, everybody goes running, and then the plantar fascia gets really inflamed, and now plantar fasciitis.
And you can't run anymore.
Can't run. Well,
we
advise it.
Okay. There are the hardcore people that will keep running with pain.
Yes, we advise against it. But yes, it can happen with overuse, and it can also be just something that happens because of the way our society is. A lot of people work on hard concrete floors, which puts a lot of impact on the foot, causes inflammation, and also the collapse of the arch that happens over time puts a lot of strain on the plantar fascia, causing inflammation. Wearing inappropriate shoe gear puts a lot of strain on the plantar fascia, causing inflammation.
Yeah. What about the overweight people? Like, you're adding more weight onto your feet.
Yeah, so we have these two little feet at the bottom that help to support our entire body. And unfortunately, with weight gain, it changes our center of balance. And that puts additional strain on the foot because it's not bearing weight the way it usually does, because your center of balance is adjusted so that you don't topple over. But that also puts additional strain on other muscles and ligaments in the foot, which then makes you more prone to injury.
So is rest the only cure for plantar fasciitis?
Well, it's one of the initial remedies, because if it's the first time that it's ever happened, you go out running one day and at the end of the day or the next morning you wake up and you have pain, then yes, rest is definitely beneficial to help to decrease the inflammation, decrease the pain that you're having. It's a first-line therapy to do at home to try to get it better. Yes, definitely. Rest, ice, wearing the appropriate shoes, not going barefoot. Not the beach. Yeah. is not ideal either. That incline is not fun for our backs, hips, knees, and feet.
Right. So what happens next? What if it does it go away?
So it can. Plantar fasciitis can be self-limiting, where you do remedies at home and all of a sudden you just realize, like, hey, my feet haven't hurt for a long time. I wonder what happened. That is a possibility. If it does not go away, treatment options include strapping, orthotics, injections. Shockwave therapy is beneficial for plantar fasciitis, basically trying to get that area, the inflammation, to calm down and getting the plantar fascia to heal itself.
Okay. So you mentioned orthotics. So who are orthotics for? Is it just for the high arch people, the low arch people, the people with plantar fasciitis? Orthotics seem to be something you can walk into Target and buy, and,
Yeah, so they are... not all orthotics are created equal.
Right.
They're over-the-counter devices and they're custom devices. So I usually recommend everybody get an orthotic. It doesn't hurt. Provide additional cushioning, additional support to the foot. Doesn't hurt. Especially.
Do you take out the insole that's in the original shoe?
Yes.
Okay.
Remove the original insert and replace it with, that way that foot isn't crowded in there from that extra height. So remove the original insert and then replace it with the orthotic.
So that way you can get an orthotic and use it in multiple shoes?
Multiple shoes, correct,
okay.
Correct. With the over-the-counter orthotics, I always recommend when you're purchasing the orthotic, put your hand on the arch of the orthotic and press down real hard. The goal of an orthotic is to be able to provide support. Now, if you put your hand and the arch completely collapses with just the weight of your hand, when you put your full body weight on it, that thing is going to be just flat, which will be equivalent to what was in the shoe originally. That's not beneficial to you at all. So making sure that when you do push down on the arch of that orthotic, it maintains its shape. And that means that it will then support your foot when you do put it into your shoe.
Yeah, I find orthotics really interesting. Will they help with an older, like a senior, someone 65 and over? Will it help with mobility and balance?
Yes, an orthotic can significantly help with balance by correcting the position of the heel, supporting the arch, maintaining a stable base is what it will do. And that can also affect the positioning of the knees and also the hips, which can help with balance and stability, and also decrease pain that patients oftentimes will have in the hips and the knees just from getting the correct orthotic.
Yeah, that totally makes sense. We are talking with Dr. Norshay Robinson, a podiatrist specializing in keeping our feet dry, warm, covered, happy, stable. And when we come back, we're going to continue the conversation. We're going to talk a little bit about our Achilles tendons and some other bony problems that we can have with our feet. And then we're going to talk about how we can make our feet feel better with stretching and activities. So we're going to keep the conversation going. So stick around. Inspiration Health Radio, sponsored by Millennium Physician Group. We'll be right back. Welcome back to Inspiration Health Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. Each week, we talk about the healthcare issues that are important to you by inviting providers and experts to inspire you to take control of your healthcare decisions. Well, as we get older, we know we need to take better care of our bodies, and that definitely includes our feet. In addition to keeping them clean and dry, we want them to not hurt so much as we age. Our guest today is Dr. Norshay Robinson, a podiatrist who specializes in helping to keep our feet happy. And Dr. Robinson, we finished the last segment talking about orthotics. We spent some time talking about plantar fasciitis, but there are other foot-related injuries, if you will, that we haven't talked about. My husband's a runner, a pseudo runner, and he always comes home, oh, my calf hurts, oh, this hurts, oh, it's my Achilles tendon, and he thinks he can self-diagnose. But let's talk about the Achilles tendon, because I had another friend whose husband tore the Achilles tendon playing basketball with his buddies.
That's the biggest one.
Oh my goodness. Let's talk. And I've heard it's excruciating.
Yes.
So let's talk a little bit about keeping our Achilles tendon healthy.
Yeah, absolutely. So the Achilles tendon is the huge tendon starts with the gastroc muscle, which is a calf muscle. And then once it tapers down, it becomes a tendon, and that tendon attaches to the heel bone. So the Achilles tendon is basically responsible for normal gait, helping you to walk normally. It's very prone to injury because it does so much.
It sounds like an active tendon.
Right.
Yes.
You're going up the stairs, you're going to use your Achilles tendon. Getting up, sitting down, walking on the beach, normal walking, running, and more so playing sports. Basketball is a big one for having injuries to the Achilles tendon. So very important.
And does it snap? Does it tear?
So usually there's micro injury that happens to the Achilles tendon, and that's just wear and tear over time. And then you go and do something big, like trying to jump and dunk a basketball, and that puts additional significant strain on the Achilles tendon, and it just completely tears, gives completely out. And it's literally like a huge rubber band that snaps. So it's really painful when that tendon basically breaks.
Mm-hmm. And then walking becomes
impossible.
Yeah. Oh my goodness. So what kind of recovery are you looking at?
Well, it depends on how the injury is treated. So if it's treated with just casting it and allowing it to heal itself, that's probably about 8 weeks to get that to heal. If it requires surgery to debride the tendon and sew it back together, essentially is what's done. About the same, 4 to 6 weeks usually, and then getting back into activities usually about the 6 to 8 week mark.
And do you do those type of surgeries?
We do.
Yeah. Do you see a lot of them?
No, we don't see a lot of them.
Good. So people are taking care of them.
I personally don't see a lot of them. Most of those people end up going into the hospital. And it's whoever is there that would treat them,
because it's that urgent.
Yes, it's significantly painful.
Oh goodness, it sounds awful. So all right, so that's one. But what is age-related pad atrophy?
So the bottom of the foot, there's fat on the foot to help to support and cushion the forces that go through the foot with normal walking, running. And as we age, unfortunately, that fat wears away. What that does is it makes the bones in the foot more prominent. And so that puts additional pressure and strain on that area, which causes pain because the padding that's supposed to be there is no longer there because the fat wears away as we age.
So that's one place we would like to keep our fat.
It would be nice. It doesn't go where you need it, unfortunately.
Just saying. Couldn't resist.
It doesn't. But with that, there are things we can do to help to augment that fat that's there. We can do fat pad grafting to replace the fat in that area. Dermal fillers work great to replace the fat pad, cushioning that area, help to decrease the pain, especially if you're dealing with metatarsalgia, which is pain directly under the metatarsals with walking, normal activity. That can significantly help to reduce that pain, if not eliminate it, because it recreates the cushioning in that area and prevents those bones from pressing directly on the skin.
Huh. Okay. Well, that's interesting, which brings us to the minimally invasive surgery for bony prominences.
Yes. So as we age, we're not as healthy as we used to be, and surgery to fix deformities can be quite debilitating for our older population. So one of the options that's available is minimally invasive surgery, and some of the procedures we can actually do right in our office. And what we're mostly focused on is not so much correcting the deformity, but removing the problem. So if there's a bony prominence that's rubbing in your shoe, creating irritation, always red, always inflamed, we can remove that bony prominence so that it's no longer rubbing. We're not treating the cause of the bony prominence because, like I said, most of those patients, that would require you to be under anesthesia, all of that. A lot longer recovery time, not weight bearing, which is detrimental to the aging population, making them non-weight bearing.
Yeah.
So minimally invasive surgery allows you to walk right away. There's no big boot or anything that would affect the hip and the knees, and it can remove areas that can become very problematic for older patients. So,
wow.
Yeah. Bunions, hammer toes, we can just get that. Yeah.
See, that is awesome because you definitely see people with the toes just look so pained, like they're bent in weird ways, and just arthritis in the feet.
Yes.
So
yeah, and that makes it difficult finding a shoe that's not painful because unfortunately shoes weren't designed to accommodate that type of deformity. So you'll get significant rubbing on the toes, like I said, the irritation that occurs, but you can also get wounds in those areas, and those wounds on the toes are very difficult to treat. And so one of the things that we can do to help to prevent that is doing a small surgery on the toe. Oftentimes that can be done in the office. There's no general anesthesia. It's just done under local anesthesia just to correct that deformity in the toe to prevent the irritation and the possibility of an ulceration in the future.
All right. Well, Dr. Robinson, that is good to know. I've noticed as I age that when I walk, I feel like my feet are starting to turn in a little more, and I don't know if it's the shoes that I'm wearing, or if it's just, are my knees getting tired? Are does it move up to my hips? I mean, does your step change as you age?
Yes. This kind of goes back to the plantar fascia. Its job is to support the arch as well as the posterior tibial tendon. And over time, there's weakness that occurs in that area that causes the arch to collapse over time, which is the turning in of the foot that you're referring to. But when that happens, it changes the position that your knee sits in, which now causes pinching and arthritis, can accelerate your arthritis because you're now in an abnormal position for the knee, similarly with the hip. So an orthotic is actually beneficial for that because it will put the foot back in the correct position that it's supposed to be in, but it will also provide support for the plantar fascia and the posterior tibial tendon so they're not under as much strain as they were trying to hold that arch up throughout the day.
Okay. Yeah, it sounds like I need to make an appointment. So let's switch gears. Can stretching help our feet?
Stretching is beneficial for your entire body.
True.
With over time, the tendon shorten, the muscle contracts, and you're not as flexible and as limber as you used to be, and unfortunately that makes you more prone to injury. Part of the compensation that happens in your body is balancing. So if you're about to fall, muscles fire to help to prevent that fall. Now if you're not as flexible and those muscles haven't been used or stretched in a long time, you're more likely to incur significant injury. So yes, being active, stretching, maintaining muscle tone. So a little bit of weight training is beneficial, especially for our older population. Maintaining that muscle tone helps to protect the joints and helps to decrease injury.
Now, what about like a foot massage or something? I know it sounds so lovely.
Just feel great.
Every night before I go to bed, I rub like magnesium butter on my feet. Okay. And I swear it helps me sleep.
Huh. Okay. I'm not going to knock it.
I'm like,
if it works.
But I think part of it is just the feeling of rubbing your feet.
Yes.
They're softer after you put some lotion on it. How important is that?
It feels great.
Yeah.
It feels great. There are several nerve endings in the feet, and just helping to massage, take some of that tension. There's muscles, relaxing the tension. It's similar to a regular massage, relaxing the tension in that area. And there's often reflexology. That I'm not really well versed to speak on. Yeah. But there are different organ systems that have pressure points in the feet that, if when rubbed, can help to alleviate issues in those areas as well. So, I mean, it feels good too. So if it gives you additional benefit outside of feeling good, I say, why not?
I totally agree with you. All right, Dr. Norche Robinson, when we come back for our last segment, we're going to keep talking about keeping our feet in balance. We're going to come back to the compression conversation because I think it's important to know about the compression in socks. And we're going to kind of just summarize a little bit of what we've talked about today. So stick around. Inspiration Health Radio, sponsored by Millennium Physician Group. We'll be right back. Welcome back to Inspiration Health Radio, sponsored by Millennium Physician Group. I'm Michelle McCormick. Every week, we're talking about the healthcare issues that are important to you by inviting providers and experts to inspire you to take control of your healthcare decisions. Well, today, we've been talking about getting older, and we know we need to take better care of our bodies, but we also need to take really better care of our feet because they keep us upright in the most part. In addition to keeping them clean, dry, we talked a lot about massaging our feet. We talked a lot about injuries to our feet, and we're going to kind of go over a little bit of that. To our guest today is Dr. Narshay Robinson, a podiatrist who specializes in keeping our feet happy. And, you know, Dr. Robinson, at the end of our last one, I wanted to bring up pedicures. All right, so you go to the pedicure place and you put your feet in the water and they soak them in the hot water and stuff, and it just feels so nice, and they clean our toenails and stuff. Do you recommend pedicures?
So,
I mean, yes or no?
I don't. It depends.
Okay.
They're not for everyone.
Right. I agree.
So it depends. I usually recommend picking a good establishment that has clean instruments, cleaning the reservoir you put your foot into. That's very, very important because you don't want to get any, that's the most common way to get bacteria and fungus. Making sure that they're not using sharp instruments on the bottoms of the feet, because you can get small cuts and scrapes that you can't even see with your naked eye, but it's big enough for bacteria to get in and cause an infection. Similarly with the cuticles, not trimming them back too far because they serve a purpose. They're there to protect the nail bed from getting bacteria and fungus into the nail bed. So it depends.
It depends. It does. It does depend. And you know, it feels so nice and you feel like you're treating yourself. And But I understand, because you can get a really bad pedicure, and it can be very painful.
Correct.
All right. So we talked a little bit also earlier about compression socks, so whether it's a sleeve or a full sock. What's the difference?
So the compression sleeve would go from just above the ankle to the calf, covers the calf, so just below the knee. Basically, between the ankle and the knee would be a sleeve. A compression sock would be a sock that extends all the way up to below the knee.
Yeah, who are they for?
So a compression sleeve is usually for athletes. It helps with muscle recovery, helps to decrease muscle fatigue, and so our athletes will usually wear a compression sleeve in the calf because that's usually is a big muscle group for moving.
Mm-hmm. Right, right.
So they're usually who wear compression sleeves, and that's not to say that anybody can't wear a compression sleeve because you'll get the same benefits. But I do recommend everybody wear compression socks it helps to prevent swelling in the feet, which swelling can cause fatigue, can also cause damage to the skin from recurrent long-term swelling. But it also prevents that aching in the ankles and the calves when you get home. And you get home from a long day of work, you sit down and your feet just ache. Mm-hmm. Compression can help with that, to prevent that.
Yeah, I see a lot of people traveling. Yes. In compression socks, you know, when they're flying, long travel, really makes a difference.
It does. And it does take some time getting used to. Usually patients will wear it a day. They're like, yeah, no, this is not for me.
But they can be hot.
We do live in Florida.
We do live in Florida.
But I find the benefits far outweigh whatever complaints you may have in regards to compression socks, especially if you have a history of high blood pressure, if you have a family history of varicose veins, or if you stand long periods in the day. Mm-hmm. Wearing a compression sock will help to support your calf muscles and help to prevent that swelling.
Yeah. It's I agree. I think they're great. Restless leg. You know, I know it's probably, I don't know, but my legs get really restless at times. And sometimes when I put on a compression sock, it really seems to help.
Yes. So venous reflux, which is backflow of blood in the veins, is one of the things that can contribute to that restless leg syndrome. Yes.
Okay. That's good to know.
So wearing a compression will help with that.
Well, and you definitely see it. Like I see it a lot at my grandmother's assisted living facility. You know, they somehow get them on in the morning. I don't know. And then they walk with their walkers. Yeah. And, you know, is there something that we can do to help our aging population take better care of their feet? You know, they're not as active,
right?
You know, and I just would love to know what we can do to help encourage better feet as we age.
Well, so it all starts before that. So taking care of your feet at any age, you should take care of them, not waiting until you get older. But the biggest thing is staying active. It helps to decrease injuries, better lifestyle, feel better, less chronic conditions from being active. It benefits everything. Definitely recommend, I know a lot of senior centers have activities and exercise programs that are tailored towards seniors, and those are beneficial, especially with maintaining the muscle tone helps to maintain balance, which is what's significantly affected in our aging population, which makes them more prone to falls and injuries. So yeah, staying active as much as possible, getting the right shoe so you can remain active. If it means getting a compression sock so you can remain active, being active is the best thing.
Yeah, orthotics too.
Yes, for sure.
Yeah, gotta get some orthotics. Dr. Robinson, that's my next thing to do. Well, Dr. Norshay Robinson, what can you leave us with today? About really just, you said it right there, just keeping our feet healthy at any time, from the cute little feet that we take, when the babies are born and we want their little footprints, all the way up to, our aging population, just taking care of our feet.
A lot of times the feet just get neglected. You know something's wrong, it's bothering you, but you just neglect to take care of it. And unfortunately, that small thing can become something significantly bigger, especially with plantar fasciitis. The sooner you come to me with plantar fasciitis, the easier it is for me to treat it. However, if you've had long-standing plantar fasciitis for several months, worse, a year, it's then more difficult to get to resolution of your pain just because it's been there for so long. Mm-hmm. So definitely seeking treatment as soon as possible to get rid of to basically cure any injuries that you have. Yeah. And that will prevent further injuries.
Is a bunion an injury?
So a bunion is more of a bony deformity.
Oh, okay.
It is on the side of the foot, that bulge that you see right before the big toe, that is a bunion, and it's a bony deformity. It's usually hereditary. The foot type is what you inherit, which makes you more prone to getting a bunion. That can then be aggravated by shoes that you wear, but shoes don't necessarily cause the bunion. Okay,
good to know. So I can still wear my super uncomfortable shoes for a limited amount of hours during the day. As my kids age and they go to their proms and they do all their stuff, they leave in these really pretty shoes and they come home in bare feet, because your feet can only handle so much.
Yes. And there's things you can do, extra padding in the shoe, a metatarsal pad to help to provide more cushion to the ball of the foot, wearing a wider blocked heel if you're wearing a heel shoe that provides additional support, a platform in the front of the shoe that provides additional support, and if it's a closed-in shoe, just making sure that there's enough room that fits your toes. A lot of times I find patients are wearing the wrong width shoe. You can't put your foot on the shoe and half your foot is kind of hanging off the shoe when you measure it on the bottom. That foot needs to be able to fit in that shoe. So it may mean that you need to get a wider width shoe to help to accommodate your foot without causing any pain to the deformities that you may have.
Yeah. Are shoes getting better, do you think? Because you see now that they're adding extra padding in shoes, or there's, a little more ventilation in shoes. Are shoes getting better?
The technology has definitely advanced from what it was in the past. Yes, I would agree. Now, what was there before is still there. You have to choose the appropriate shoe gear for you. But yes, there is significant technology with whether it be cushioning in the shoe itself to help to decrease the amount of pressure that's placed on the foot, more support in the arch of the shoe. There are several things. Fabric on the top of the shoe to help to prevent irritation and rubbing to hammer toes and bunions. Significant, change in the technology and the way shoes are made.
Yeah, we could probably do a whole show just on shoes and laces, or laces versus non-laces, and memory foam, and so on and so forth. Well, Dr. Norshay Robinson, tell us how we can get in touch with you, and if we have any feet questions, because I'm writing down orthotics right now.
Absolutely. So my practice is Meridian Podiatry. Our address is 4123 University Boulevard South, Suite F as in Frank, Jacksonville, Florida, 32216. Our phone number is 904-701-3140. And if you want to get more information, you can visit our website, meridianpodiatryclinic.com.
Right. And in most cases, you don't need a referral to see you?
No, most insurances don't require referral, but you can always call, request an appointment, provide your insurance information if you have insurance, and we can check to see if a referral is required. We also take self-pay patients as well.
Okay. Well, thank you so much for answering and talking all things feet today.
Thanks for
really
having me.
Appreciate it. Well, the conversation will continue next time on Inspiration Health Radio. Your healthcare journey, very important to us, and our goal at Millennium Physician Group is to work together to achieve the best health outcome for you, and that includes nice referral partners like Dr. Robinson. But Always see your primary care provider first, too. See our website for our full list of offices and providers at millenniumphysician.com. In good health, I'm Michelle McCormick. Have a great day.